Definition. The Greek word edema means swelling. Edema is defined as abnormal and excessive accumulation of free fluid in the interstitial tissue spaces and serous cavities. Types. Edema may be of two main types: localized, generalized. First is localized, when limited to an organ or limb. Example: pulmonary edema, inflammatory edema, allergic edema, lymphatic edema, cerebral edema, etc. Second, generalized, when it is systemic in distribution, particularly noticeable in the subcutaneous tissues. Examples: renal edema, cardiac edema, nutritional edema, etc. Depending upon fluid composition, edema fluid may be transudate, which is more often the case, such as in edema of cardiac and renal disease. Second, exudate, such as in inflammatory edema. Now, pathogenesis of edema. Following mechanisms produce edema: decreased plasma oncotic pressure, increased capillary hydrostatic pressure, lymphatic obstruction, tissue factors, increased capillary permeability, sodium and water retention. First, decreased plasma oncotic pressure. Plasma oncotic pressure exerted by total amount of plasma proteins tends to draw fluid into the vessels normally. A fall in the total plasma protein level results in lowering of plasma oncotic pressure. This results in increased outward movement of fluid from capillary wall and decreased inward movement of fluid from interstitial space, causing edema. Example of edema by this mechanism are edema of renal disease and edema of liver disease. Second, increased capillary hydrostatic pressure. Hydrostatic pressure of the capillary is the force that normally tends to drive fluid through capillary wall into the interstitial space. Rise in hydrostatic pressure at venular end more than plasma oncotic pressure leads to excessive filtration of fluid from capillaries into tissue spaces, causing edema. Example of edema by this mechanism are edema of cardiac disease, passive congestion, postural edema. Third, lymphatic obstruction. Normally, interstitial fluid in the tissue spaces escapes by the way of lymphatics. Obstruction to outflow causes localized edema called as lymphedema. Example of lymphedema includes removal of axillary lymph nodes in radical mastectomy of carcinoma of breast, causing lymphedema of affected area. Inflammation of lymphatics as seen in filariasis, Milroy's disease or hereditary lymphedema. Fourth, tissue factor. Two forces acting in interstitial space are oncotic pressure of interstitial space and tissue tension are normally small and not significant, but in some situation tissue factors in combination with other mechanism causes edema. Fifth, increased capillary permeability. Capillary endothelium is a semi-permeable membrane which permits the free flow of water and crystalloids, but allows minimal passage of plasma proteins normally. If capillary endothelium is damaged, then capillary permeability to plasma protein is increased, causing leakage of plasma protein into interstitial fluid, producing edema. Sixth is sodium and water retention. In kidney, there is hypovolemia, which causes renal ischemia. So, the sodium decreases in renal tubule, which stimulates angiotensinogens, which causes retention of sodium and water, leading to edema. Important types of edema. First is renal edema. Generalized edema occurs in certain diseases such as in nephrotic syndrome, nephritic syndrome, acute tubular disease. First, edema in nephrotic syndrome. Since there is persistent and heavy proteinuria in nephrotic syndrome, there is hypoalbuminemia, causing decreased plasma oncotic pressure, resulting in severe generalized edema. Hypoalbuminemia also causes fall in the plasma volume, activating renin-angiotensin-aldosterone mechanism, which results in retention of sodium and water. The nephrotic edema is classically more severe, generalized and marked, and is present in the subcutaneous tissues as well as well as in the visceral organs. Second, edema in nephritic syndrome. Edema occurring in conditions with diffuse glomerular disease such as in acute diffuse glomerulonephritis and rapidly progressive glomerulonephritis is termed as nephritic edema. In contrast to nephrotic edema, nephritic edema is primarily not due to hypoproteinemia but is largely due to excessive reabsorption of sodium and water in renal tubules via renin-angiotensin-aldosterone mechanism. Nephritic edema is usually mild as compared to nephrotic edema. Edema in acute tubular injury. Acute tubular injury following shock or toxic chemical results in gross edema of the body. Second, cardiac edema. Generalized edema develops in right-sided congestive heart failure. Pathogenesis of cardiac edema is explained on the basis of following mechanisms. Reduced cardiac output causes hypovolemia, which stimulates intrinsic renal hormone, extrinsic renal hormone, and ADH secretion, which results in sodium and water retention and consequent edema. Due to heart failure, there is elevated central venous pressure which is transmitted backward to venous end of capillaries, raising the capillary hydrostatic pressure and consequent transudation. This is known as back pressure hypothesis. Chronic hypoxia may injure the capillary endothelium, causing increased capillary permeability and result in edema. This is called as forward pressure hypothesis. Pulmonary edema, most important form of local edema. It causes serious functional impairment. Etiopathogenesis, elevation in pulmonary hydrostatic pressure, increased capillary permeability, and acute high altitude edema. First, elevation in pulmonary hydrostatic pressure. In heart failure, there is increase in pressure in pulmonary veins which is transmitted to pulmonary capillary bed. This results in imbalance between pulmonary hydrostatic pressure and plasma oncotic pressure. Excessive fluid moves out of the pulmonary capillaries into the interstitium of lungs. Prolonged elevation of hydrostatic pressure and due to high pressure of interstitial edema, the alveolar lining cells break and the alveolar air spaces are flooded with fluid, driving the air out of the alveoli and thus seriously hampering the lung function. Example: left heart failure, mitral stenosis, cardiac surgery, pulmonary vein obstruction, nephrotic syndrome. Second, increased vascular permeability occurs due to damage of alveolar capillary membrane, causing increased vascular permeability so that excessive fluid and plasma protein leak out, initially into the interstitium and subsequently into the alveoli. Example: ARDS, shock, inhalation of toxic fumes. Third, acute high altitude edema. Individuals climbing to high altitude suddenly without halts and without waiting for acclimatization to set in suffers from serious climatic and respiratory ill effects. Deleterious effects often begin to appear after an altitude of 2500 meters is reached. These changes include appearance of edema fluid in the lungs, congestion, and widespread minute hemorrhages. These changes can cause death within a few days. Underlying mechanism is due to anoxic damage to the pulmonary vessels. Thank you.